PTSD, the full form is post traumatic stress disorder. That means that there has to be some specific trauma that has caused a significant level of stress, which causes uh, difficulty in day to day activities of life, be it your personal domain, social domain, or occupational domain. So there has to be a significant stressor. It can be a personal trauma the person must have gone through, or it can be on a community level, a shared one, like some terror attack or any kind of natural disaster that one must have experienced. So, post these experiences, these traumatic experiences, when a person goes through a very stressful period of time, okay, and these stressful periods are not just like they don't get resolved by themselves. They cause significant level of disturbance in day to day life. The most important thing is that flashback, or in the form of dreams, they occur. So if someone is facing or have gone through these sort of traumas, so they'll have flashbacks, a true living experience of the same traumatic time that they have experienced in the past. They will have, they can have imagery, they can have physical symptoms, they can, a sense of aura that creates amongst themselves that actually makes them relive the experience entirely, or very problematic or very stressful memories in terms of dreams, they can relive that experience. This is a major thing that major symptom. So apart from this, it also hampers their thinking, their cognition, the way they make decisions. They have difficulty in retrieving information. They have difficulty in concentration. They are not able to focus on the problem. On the other domain, if I see, then they have problem in socializing as well. Feelings of guilt are quite common in PTSD. There are specific differences when it comes to children and adults. So if we divide children, if we particularly see child population, then children and adolescents. Like in teens, similar symptoms are there related to adults, but in addition, they become quite restrictive regarding things. They stop being social, or discussion is like becomes very minimal with them. They become very aggressive, extremely irritable, because they don't know, these children, they don't know how to cope with it or how to express it. The late teens that I'm talking about. And if we see child population, children specifically younger than 6 years old, so we can see that these children, they become aggressive during their playtime. Also, if the child might immediately start to do bedwetting, even though they've had toilet training before. The child might become mute at times, or it becomes like very difficult for them to express. So these are the signs and symptoms which differentiates children going through PTSD, then teens, and then adults. There are no specific causes, but there are risk factors that actually make people more vulnerable to experience PTSD. It may vary from individual to individual. So, if I talk about the past history, or any past or personal history, family history of mental illness or mental disorder, the person might have vulnerability to anxiety running in family. So if they undergo some similar stressor or trauma, then they are more prone to get PTSD in comparison to a person from a normal population. The people, they themselves might be experiencing some history of mental illness or anxiety or substance use. So they are more prone, or they have more vulnerability to experience PTSD. Diagnosis is dependent upon the symptoms that we have discussed earlier. The symptoms of having flashback memories or in dreams, reliving those experiences. Then having at times they can have anxiety symptoms. They are feeling like autonomic anxiety symptoms like excessive sweating, hot flushes or cold flushes, irregular breathing pattern is there. They can feel numbness, but PTSD can occur without these symptoms as well. Like a person might relive those moments or that flashback is there, that feeling, intense feeling is there, but might not show those autonomic symptoms. Then there is a significant level of avoidance from the person, avoidance related to the cues that are there, cues related to traumatic experience or triggers related to traumatic experience. They try to avoid those things. The third one is they go for social withdrawal, the withdrawal from the society, their workplace, their family. These symptoms, if these symptoms they start to show from the time when the person has experienced that traumatic experience, then within 6 months of time, this can be diagnosed as PTSD, provided we need to look for the comorbid factor or the coexisting factors if they are there or not. And as far as treatment is concerned, so there are two lines of treatment: the psychotherapeutic treatment and the pharmacology or the medication thing. So you can visit any mental health professional, either a psychiatrist or a clinical psychologist for the same. Then, for as far as the psychotherapeutic treatment, there is CBT, cognitive behavior therapy, that actually focus upon the thoughts which are related to that particular event. There is also it also includes the exposure, like a very gradual exposure to the cues of that environment or that place, right? So if there is a gradual exposure, the person will gradually, slowly, very slowly start to feel comfortable. There is going to be less avoidance or fear related to that situation. And in CBT it is about thoughts, that we work upon the errors the person might be making while experiencing those thoughts. The person feels extremely guilty because like in let's take an incident of terrorism. Okay, so the person, they might feel guilty that they were not able to save their co passengers or the colleagues or any nearby person at that moment of time in that situation. They might feel guilty about the fact that they were not able to take that move that they could have, or they might have expected from somebody else. So the feelings of guilt, the feelings of regret, we can work upon these areas. We can work upon thoughts associated with these areas by using CBT. The domains like personal, social, and occupational areas. These three areas, if you experience dysfunction in these three areas with the given symptoms that I have mentioned, like if you're having flashbacks, if you're having nightmares or difficult memories which are related to your traumatic experience, if you're not able to focus on the three domains that I've just mentioned, if you're having difficulty in attention and concentration, if your productivity is low, if you're having significant disturbance in social interaction, so if you're going through a lot more things like these, if you feel like you are clearly avoiding those cues or those incidences which are somewhere related to the traumatic experience, that particular site of trauma, or any particular cue, people related to it, or TV shows might be related to it. So if you're avoiding those things, in addition to those that I have discussed, then you should visit a mental health professional. Also, one more important thing is that timeline. So every disorder, they have a timeline to it, attached to it. As per those timeline, we give a diagnosis. So what happens in PTSD in majority of the cases, the timeline is that PTSD should begin or it starts showing symptoms within 6 months of the period of the trauma that has existed or the trauma the person has experienced. So within 6 months, if these symptoms they try to show, then you are supposed to visit a doctor, probably a psychiatrist or a clinical psychologist for help. It is very important to be there with the person. Despite of giving regular suggestions, or telling the person you should not do this, you should do this or that. It is very important to sit there and to listen to that person, that what he or she is going through. The first and the foremost thing. Then you yourself can, check out the resources, probably resources. If you think that it might be PTSD, then you yourself can consult someone uh, in the place of your own closed one, the relative, family member, friend. Okay. And then what can happen is that you can be there with them throughout their consultations, with their sessions. You can act as a support. You can keep a check on them, that whether they are able to follow the treatment or not, how they are doing up with the treatment. Is there any difficulty that they are finding with the treatment or not? And if you feel like that, the family is distant, then probably you can act as a psychoeducator to their family. You can inform them, you can make them more aware. So these are the things that people who are close or nearby the sufferer, they can help with.